Hey everybody, it's Paul Barrett from the Modern Medicare Agency. Making a quick video for you folks out there today that are on Medicare, just to get you warmed up and prepared for this 2025 Medicare season. Why? It's the middle of summer, because it's going to be crazy, guys. I mean crazy. So many changes going on. The Inflation Reduction Act is really bringing a lot of stuff to the table this year, and it's going to affect pretty much everybody on Medicare. So let's talk about it, specifically with Part D, right? The Inflation Reduction Act, 1,000 pages, 1,300 pages, right? So we're not going to cover every single thing about it, because it's not all going to pertain to you, but we're going to cover Part D because everybody pretty much uses Part D. Whether you have a Medicare Advantage plan or a standalone drug plan this year, you're going to have a $2,000 maximum out of pocket. Wonderful stuff, right? That means what? It means if you spend $2,000 and it's June, the next time you go to the pharmacy, you don't have to pay. It's covered 100%, right? No more payments, no more co-insurance. So $2,000 max out of pocket is going to help, at least based on the information that I saw from 2021. KKF, it's a financial reporting service that does great blog articles and research on these types of things. They said 1.5 million people paid over $3,000 in 2021. I'm sure the number was probably a little bit higher last year. All right, so 1.5 million people going to be very happy they're not going to spend that much this year. Next, balance billing. Balance billing is something I've always thought would be a great idea. A lot of folks get on Medicare, low income, and it's so difficult to manage their budget because they get a couple expensive prescriptions. The deductible with Medicare Part D has gone up, and up every year, right? So it's expensive. You got to pay that deductible plus the copay before you can get your prescriptions. Now they're allowing us to take the total cost of your prescriptions for the year, total them up, divided by 12, boom, balance billing for the year. If you sign up in February, don't worry, we're going to balance bill you for 11 months and I'll prorate it that way. But it's an opt-in program, you got to opt in to do it. It's not going to help everybody, but it's going to help a decent amount of people manage their budget, which is wonderful. Okay, so $2,000 max out of pocket cap sounds great. It means a lot of people aren't going to spend over $2,000. Awesome. Balance billing, very helpful. I think that's great. Now, what's the downside to all this? The downside is this. Somebody has to make up the difference. The insurance companies aren't going to just say, okay, we're going to make 65% less profit this year. So a lot of experts and people talking in the industry are predicting quite a few things that I happen to agree with. Number one, Part D premiums are going up every year. It's very consistent. This year we expect a slightly higher bump. Okay, that means Part D is going to cost more. In 2023, the national average for a drug plan was about $33. In 2024, it was $55. If you lived in New York in 2024, that's where I live in my offices, it was $72. You get the point. It's going up. All right. The deductible for Part D will be higher. It will go up. So you have higher premiums, higher deductible. You're probably going to have higher copays as well. All right. The other thing is they're going to make it a little bit more difficult. They're probably going to give us less options. Some companies are going to opt out of this altogether. They don't want to deal with it. It's not a huge profitable thing for them. So they'll get out. Right. So instead of having 15 options here in New York, I'm predicting we'll have somewhere around 10, maybe a little less. Then on top of that, the people that do stay in the business, they're going to probably have more prior authorizations and step therapies and different things to make it slightly more challenging, right? Their goal is to have as many clients as possible, pay premium, and utilize their plan as much as possible. That's how they profit. They're a company. They're an organization. They need to make money. So with all these great things, the $2,000 maximum out of pocket and the balance billing, we are going to see some disruption and discomfort with the normal things that we're used to with Part D. Definitely going to have highest premiums we've ever seen, highest deductibles we've ever seen. We're going to see less options. And then on top of that, as an agent, you might not care, but obviously I know there's companies out there that are planning on not paying us commissions to help you guys. It's not a good thing. Just going to Medicare.gov or one of these websites trying to figure it out isn't always the easiest thing to do. When it comes to Part D, none of us out here make a lot of money as an agent. They don't pay us very much, and it's very complicated. But it's a service we provide for you, very important service. So you might have less agents to help you. You're going to have less choices, and you're going to have some expenses. So for all of us who don't pay over $2,000 a month on average for a year, you might be a little disappointed in how it works out. Everybody else was probably be pretty happy. But if you have questions, concerns, you want help with any of this stuff, we're going to be hosting webinars and doing all kinds of fun stuff as the summer progresses and we get more ironclad details. So thanks for watching, and comment below if you have any questions. Love to chat with you.